The Florida Clearinghouse. What is the Agency for Healthcare Administration's Florida Clearinghouse, and why is it important? What is the Florida Clearinghouse? Changes in law passed during the 2012 legislative session significantly modifies background screening for many service providers regulated by a variety of state agencies, including healthcare providers licensed by the Agency for Healthcare Administration under Chapter 408, Part 2 of the Florida statutes. Now, House Bill 943 created a care provider background screening clearinghouse, or clearinghouse. The purpose of the clearinghouse is to provide a single data source for background screening results of persons required to be screened by law for employment in positions that provide services to children, the elderly, and disabled individuals. The clearinghouse shall allow the results of criminal history checks to be shared among specified agencies when a person is applied to volunteer, be employed, be licensed, or enter into a contract that requires a state and national fingerprint-based criminal history check. Why is being entered into the clearinghouse important? If you submit a photo at the time of fingerprinting, your background check will be retained for 5 years. This means that when you apply for a new job that is regulated by the Agency for Healthcare Administration, Department of Children and Families, or Department of Juvenile Justice in the state of Florida, your new employer can retrieve your background check directly from the system without a need for a new set of fingerprints. Now, if you do not submit a photo at the time of fingerprinting, then you will not be entered into the clearinghouse. This means that when you apply for a new job or license in the state of Florida, you will have to pay for another background check and get re-fingerprinted. How do renewals work? The applicant or employer may initiate a clearinghouse renewal 60 days before the retained fingerprint expiration date is reached. If the clearinghouse renewal is not initiated before the retained fingerprint's expiration date, a new screening will need to be initiated in the clearinghouse, and the applicant will have to be re-fingerprinted again. The applicant and/or the employer will receive notification of upcoming expirations for those employees listed on the employee or contractor roster. The benefits of clearinghouse renewals. You can request and pay for the new renewal of a screening all in one system, while also receiving cost savings. Faster processing time, since the request is immediately sent to the clearinghouse. There's no need to wait to be fingerprinted again. An updated criminal history to ensure compliance with background screening requirements, and you get to extend the retained fingerprint's expiration date by another 5 years. Still have questions? If you need to get fingerprinted for a clearinghouse screening, please visit our website at www.fingerprinthelp.com. If you have questions about the registration, process, or other operation of the Care Provider Clearinghouse portal, contact the AHCA Background Screening Unit directly at bgscreen@ahca.myflorida.com or call them directly at 850-412-4503. Thank you and have a good day.